You are watching an AIDS Meds and Pause video from the 16th Conference on Retroviruses and Opportunistic Infections in Montreal.
This is Tim Horn, the editor-in-chief of AIDSmeds.com, and I am here with Dr. Sharon Hillier of the University of Pittsburgh School of Medicine. This is the second of our two-part interview discussing biomedical approaches to prevention. In the first part of this interview, we talked about some of the issues with pre-exposure prophylaxis, or PrEP. In this segment, I very much wanted to talk with Dr. Hillier about antiretroviral therapy, mostly in those who are currently infected with HIV, and how that potentially benefits in terms of prevention. Let's just start with by talking about a presentation that took place here on Sunday afternoon. Christoph Fraser of the Imperial College of London, he gave a fascinating talk regarding the effects of antiretroviral therapy on transmission. A key argument was that with universal HIV testing and universal treatment, basically getting everyone who is positive onto treatment as quickly as possible, this will have a tremendous impact on transmission rates of HIV. I'm just wondering if you could talk a little bit about that.
It's a really exciting notion that's come into the HIV prevention area, the notion that we could potentially screen everyone, identify who's infected, put them on treatment, and by then controlling the virus, drive the transmission down. That is to say, by treating infection, you stop transmission. And so this is called the screen and treat. And it's become a mantra among many quarters as a simple way. It's a simple model to try to stop HIV prevention. The idea of screen and treat is an important one, and it sounds simple, but there's a lot of difficulty in how it might be implemented. So I think it's getting a lot of important scientific review right now, and I think there needs to be a lot of discussion to find would it really work if it was rolled out in the United States and internationally.
Okay, which is, I think, that whole concept really served as the basis of a big statement from Switzerland by a number of researchers there that reducing viral load to undetectable levels really is associated with I think they had put it as really no risk. But I think that a lot of people are thinking of it as a very, very low risk of transmission. Now, let's just back up there for a second. With respect to universal testing, and I think this is when we're talking about screen and treat, is that universal testing essentially making everyone who is infected aware of their status. And I'm just thinking that that in itself is a very important component to this, because the fact is that we do see that a number of people, and most people who do find out that they have status, even with a little bit of counseling, they are going to take necessary steps to really kind of keep the virus with themselves, to not pass the virus forward. So I'm just wondering, can we achieve a great deal of prevention and to achieve these goals of really slowing or even halting the transmission of the virus through universal testing without necessarily having to put everyone onto treatment immediately, which certainly has a great deal of validity in parts of the world where treatment isn't universally available yet to everyone who is infected.
Right. You bring up a lot of really good points. Could we do a lot just by increasing screening and knowing your status? I know in my town, Pittsburgh, we have a Know Your Status campaign where we go, advocates in our community, go door to door in buildings, in businesses, and ask everyone to accept an HIV test, because knowing your status empowers you to make changes in your own behavior. So I think we haven't done very well in the United States yet, even though we have recommendations for more universal screening. That hasn't been accomplished. So I think you're exactly right. We need to accomplish that goal first in the United States, in Europe, and in the world to have better acceptance of screening. I think the next question is, could we then harness the resources, the capacity, the infrastructure to make treatment more broadly available? Again, a really important goal, one that's going to be very difficult to achieve. And I think one that a doable first step is to really increase the acceptance of screening and giving good counseling, allowing people to act on their own, to modify their behaviors, to empower themselves with that information, to get health care when they decide they're ready for treatment.
And in your experience as a clinician and as a researcher, do you find that patients of yours, for example, who do find out that they're positive, when they find out that they're positive, that most, if you will, do take necessary steps, or at least telling you that they take necessary steps to stop the forward transmission of the virus?
As a researcher, and I am a researcher, what we learn in our studies is that people who find out that they are infected, after they can begin to accept that information, do act, and want to, in the women, the populations that we work with, really concerned. How do they protect their children? How do they protect their partners? So I think that there is a powerful force to be harnessed just in extending screening.
Okay, no, absolutely, absolutely. And there certainly is no doubting the profound effect that treatment can and does have on transmission rates. I think that there were we've seen a few studies here that have shown that. Certainly in Uganda we've seen that now repeatedly from the same study, that it really the lower the viral load, the lower the risk of transmission. However, that begets another issue, and something that was quite a focus here, which is the issue that one can have an undetectable viral load. However, there seems to be evidence that someone who does have an undetectable viral load in their blood can in fact have detectable virus in their semen, as well as in, like, let's say the female genital tract, or whether it be in the cervix or in the vagina. So I'm just wondering, number one, if you could talk about that just a little bit, and also if you can provide a context for that, like how concerned do we need to be regarding those research findings?
Well, it's a really an interesting set of papers that were presented at this meeting, Tim, and really, I think, bring up that very critical question: how safe are you once you're fully controlled in terms of having your viral load under control, undetectable systemically in the blood? Are your genital secretions free of virus? That's really the key question. Two studies presented at this meeting, one from France, one from Canada, both showing exactly the same thing, that even though the virus is completely undetectable in the plasma, we're still finding that some people are shedding virus in the genital tract. And so that means that even though a man has perfectly good control, he could still infect his partner by shedding virus. The risk is lower, there's no question, but it is absolutely true that it could happen. The investigators showed that the virus that was present in the semen of these men with perfect viral load still was infectious.
Okay. A question on that is, do we have a sense of what the prevalence is, or what the like, let's say, what percentage of men or women who have undetectable viral loads in their blood may have detectable virus in their semen or in their genital tract? Is that possible?
Well, it's a little bit tricky. It seems like an easy question to answer, but not so easy, because what we've learned about viral shedding in the genital tract, both in men and women, it's not on or off. It's on some days, on maybe even some parts of some days, and then off.
That's very interesting.
And so a really critical thing is it's not that you're a shedder or a non-shedder. In the context of good viral control systemically, what we see is that small things can actually increase shedding locally, and it's not necessarily predictable. And so it's not as often as if someone has an acute infection or high viral load systemically, no question, more likely to be shedding virus all the time. But there are sporadic episodes of shedding, and some people, it's not completely predictable. And that, I think, unpredictability is what makes it hard for HIV-infected people to decide when might it be safe. Same sort of story with women. Even though women have had good viral control with systemic therapy, no viral detectable virus in the plasma, we can still see genital shedding. More often, sometimes, if women have genital infection, yeast vaginitis, many other typical kinds of infections, and yet it's not always predictable. So I think the lesson for people is that getting your viral loads down is great, but having no detectable virus systemically, does not mean you're not shedding virus genitally.
Okay. Which I guess raises the issue again. It's like, do you or don't you take off the condoms, what have you? So that's very, very interesting. Very, very interesting. And I think that we can all look forward to more data regarding those particular findings. So, Dr. Hillier, thank you very, very much for joining us.
Thanks so much, Tim.